Hi everyone, in today's video I'm going to teach you how to tape your knee. This method is very good against inflammation and all you would need is some Kinesio tape. I have a green one today, but the colors don't really matter. My colleague that does taping, she showed me this method, so let's get to it. Firstly, we're going to cut out around 5 sections. So 1, 2, 3, 4, 5. And we're going to just make a cut. And do that again because we need 2 stripes. So once we have the 2 stripes, what we want to do is we want to round the edges on the top part. This will be the anchor and we're going to place it on the knee, on the quad muscle, and then we're going to put all the other stripes after. So usually the part that you place first, you call the anchor. So I'm just going to take that and smoothly round the edges. It doesn't need to be perfect. And this is mostly done because if you don't do it, the tape comes off faster. So usually my tape lasts around 5 to 7 days. It depends on what I'm doing. But yeah, you can also shower with it. Usually it stays for quite a long time. So once we rounded the edges, we want to take the first top section, the 5 little squares, and you want to tear it just like that, tearing the paper, so that later on you can take it off easier. Do that as well for the second one. Okay, perfect. Now we're gonna go to the part where we cut out the stripes. Mine is not so evenly drawn, like the lines are a bit off. So what I'm gonna do is I'm just gonna cut in the half of each section because it starts with a half square. Sometimes they're placed a bit better and you can just cut along the line. But today, this new roll that I got starts with a half. So, and we want to be cutting right until the anchor part. So right until the paper is broken. So now it's gonna look like this. For me, it reminds me of a little octopus. And what we're gonna do now, this is a bit harder, but we're gonna round the edges on the bottom parts. Just like that. Sometimes the tape gets stuck to the scissors. So something like this. Now that the edges are nice and round, let's get to the second one. Sometimes it's a bit hard to cut through the tape. Cutting paper is a bit easier because it's so sticky. So same thing here, we're gonna round the edges. I find it also influences what I wear when I go to bed. So if I have longer pajama pants, it tends to be better because if I sleep in shorts, then somehow during the night when I turn, sometimes they get caught on the sheet and then they start peeling off. So now we should have 2 of the same little squids. Now let's get to applying the tape. So since I have my ACL torn, I usually put the one going from my right to my left first. Yeah, but I don't know if it's a big difference or not. So ideally, how we want to place it is that I usually do that the knee is in the middle. Definitely the anchor has to be on the quad muscle. So I just think to make it a bit more evenly, so it goes out, the swelling goes out this way and that way, I just place it usually in the middle. So now since this part is ripped, what we're gonna do is you're gonna detach it and we're gonna measure that the lines are somewhere in the middle of the knee and then remove the paper and gently apply the anchor. After you did one, usually I just flip them back and apply directly the second anchor. Approximately on the same level. I'll turn around for this one. So peel back the paper. Oops. Make sure that things don't get caught. And then gently stick it onto the leg. So now that that's done, I usually start by doing the middle stripe. So, And the most important thing for this taping method is that you do not stretch it. So you don't need to do 80% or 50%. You just leave it the way it is without stretching it and gently apply it down. So what you want is also to really press it firmly that it doesn't unstick. The second one, we're going to take it and do a little bit, maybe like 1 centimeter. Don't know how much in inches that is, but just following the first one, just like that. Now the side one, same thing. 1 centimeter away, through the middle and down. We do that 2 more times. Yeah, so usually, I don't know if you saw it when I did the inside, but here on the outside I can show. I just usually gently move it out and then I kind of bend it to follow along the previous one. So pat it down very well. And let's get to the other one. Through the middle and down, kind of like building a net. My colleague also did this taping method to my grandma when she fell down on the street, and she had a huge bruise on her thigh. And it helped the bruise go away. So when she took the tape off, what happened is that between the tape it was still black. I mean, black. She had a very bad bruise. But where the tape was, it was almost gone, so it was almost white again. And I thought that was incredible how such a subtle thing, because usually you don't feel it, you don't feel the tape when it's on you. Yeah, and how it can help so much. Okay, almost done. So on this side as well, you want to pat it down. And what I forgot to mention in the beginning is, as you are taping, it's very important to tape in a bend position. So my leg is around, I don't know, 90 degrees bent. So pat it down once again, especially the edges because they come off easily. Really press it firmly into your skin. Okay, so there we have it. I hope you enjoyed watching the video. If it helped you, put a thumbs up and subscribe for more.